Just, we'll use this.
No, you want me to get it now?
I just wait.
Yeah.
First time wearing my new coat.
That's what I was this first time I've ever seen you in a lab.
Hi Tampa, I'm David Reina, a chiropractor with Orthopaedic Institute, and with the COVID-19 shutdown, with all of y'all quarantined, I'm sure that many of y'all are on the computer or laying on the couch, and hopefully you're outside enjoying this beautiful day. So I'd like to explain to you a couple of things that maybe you can do at home to help your posture, maybe reduce some pain and some headaches. So I'm gonna have my assistant come over here to help me out. Just one second. This is Leah. Say hey, Leah. Again, so many of y'all on the computer. Let's have you come over here and sit down like you're on the computer. You got it. As you know, there you are on the computer. You're looking at all the graphs. Your head slumped down. You're in this concentrated form. What happens is the deeper neck muscles start to strain, and the deeper neck muscles actually begin in the upper part of the back. All right. So one way to be able to bring your head and your neck up to improve your posture is to grab a towel, roll it up, lift up the bottom, and stick it right there. So notice once we place this right underneath our bottom on the coccyx or the tailbone, the posture goes up, your head goes up, and the neck muscles relax all in this region. So one of the other reasons that this is important is because of this. If you come over here. Here's the heart, and then you have blood vessels that come out of the heart and also go up into the head. Slouch for me. When you slouch like this, you compress the blood vessels through here and through here, which increases pressure on the head, which can cause migraine-like headaches. So by improving the posture, it drops the pressure, takes the pressure off of the blood vessels, and it reduces the headache type of pain syndrome. So,
That was great.
so stand up for me. Heat and ice, common question everyone always asks. What do I use? Do I use heat or do you use ice? I like using ice or coldness. Okay, one of the reasons that I like using coldness is because it's actually relaxing, number one. Number two, it can reduce pain and it increases some muscle tone. So you might think, why do I want to increase muscle tone? Well, many times when the neck is down in this position, what's occurring is these muscles are getting weak. So when you increase the tone of the muscle using some coldness, it can actually help to support the weight of the head. If you use heat, the muscles and the fascia in this area here can become congested, and although heat's going to reduce some pain, it can congest the tissue, so in about an hour or so it's going to ache again. So the proper way to use some coldness is to put a shirt on, something similar like this, about a t-shirt thickness. Use a cold pack in between your shoulder blades. You can also use it down on the region of the sacrum or the tailbone. Put it on for about 10 or 15 minutes. At about 2 minutes, you're going to have an aching type of pain. That's a normal response just before it goes numb. Again, place it in between the shoulder blades, lay down, relax for a few minutes, take it off. In about 2 hours, when the tissues recover, you can place the coldness on once again. So exercises, we're asked commonly, what kind of exercises can we do for posture? Do I need TheraBands? Do I need weights or anything? I'm going to show you a very simple exercise that corresponds with what we just showed you. That's going to help to improve your head neck posture set or your position. So Leah's really good at this because she's seen us do it a bunch of times. All right, so what's important is we want to keep the hands right here at about your belt level. And we're going to bring the shoulders back. Now remember, don't bring the shoulders up because everybody's stressed and they're doing this already. We want the shoulders to go back to bring your shoulder blades together. Keep the elbows by the side, and then you want to rotate out. And then turn your head to one side. Turn your head, there you go, and then turn your head to the other side. So what we're doing now is this. Turn off for me, Leah. So what we're doing in this position is we're contracting the back muscles, the head's coming up, we're contracting the deeper neck muscles as well, and we're contracting the shoulder muscles that are all going to hold you up. So by doing this repetitively as many times as you can, as long as you keep a good form, this is going to help to reinforce, again, your posture set and the endurance of your posture muscles.
That was good.
All right, so let's go to the lower back real quick. Come on over here, fold. All right, I'm gonna have you lay on your back for me. Again, sitting for prolonged periods of time, what ends up happening is your brain forgets where your bottom is. It's called glute amnesia. And your gluteal muscles are important because that's a big muscle that helps to hold you up. So as you become weaker in your gluteal muscles, you take on this type of a posture. It's called an upper lower cross syndrome, basically a kind of a crunch posture. So here's a neat thing that we do as chiropractors. It's called sacro-occipital technique. And I commonly show patients how to block themselves at home so they can reinforce normal position of your pelvis and take back pain away. So if you're a right-handed person, most commonly, you're going to block high on the right. So what this means is this. If you just get a towel and you lay on your back just like Leah is, and you roll the towel up like this, and you find this bone in the front, lift up here, you put the towel underneath there, and then you notice where your hand hits on this side here, roll up another towel, and then lift your hip up and put it back down. Comfortable?
Yeah, that feels good.
Yeah. So you just lay in this position for about 3 minutes and relax. So the reason we're doing this is because with a right-handed person, the tendency is for the pelvis to twist a little bit. And when it twists, what it does is it has an imbalance in the pelvis and an imbalance in the joint, and then a muscle imbalance occurs which can travel up the spine. So what we're doing here is we're basically placing the pelvis in a more normal position so we can have a normal stress on the joints and relax the muscles and balance the muscle system out in the lower back. After about 3 minutes, you can get up and do your general activities of daily living and work. Just come on up for me. A neat little exercise that you can do that corresponds with this that'll actually amp up the blocking technique is a standing hip extension. Stand up for me. So, you can stand like this. That's good. Again, what we want to do is we want to turn on the butt muscles. We want to turn on the back muscles so we can hold you up. Simply bring your arms out like this, and then Leah, we're going to have you just extend back. So just bring your leg back.
My leg?
You got it, just like that. And then you repeat, and then go forward, and then back. Exactly. And then back. And then back. And then back. Back. Put a little music on.
That feels good.
There you go. Put the TV on, and then you can alternate legs and just go back again, just like that. And here you've got a combined exercise where you're improving balance, posture, movement, and coordination. This is David Reina and my medical assistant Leah, and Tampa. Stay safe and stay active.